Dexlansoprazole is effective for the symptomatic relief in non-erosive gastro-esophageal reflux disease patients. In gastro-esophageal reflux disease, the bile acid or stomach acid irritates the lining of food pipe by flowing back into the esophagus. Proton pump inhibitors are commonly prescribed to treat gastro-esophageal reflux disease. Dexlansoprazole is a new generation proton pump inhibitor that decreases gastric acid secretion and reduces gastric acid production. The objective of the study was to evaluate safety and efficacy of dexlansoprazole dual delayed release capsule in adolescents with symptomatic non-erosive gastro-esophageal reflux disease. The study was an international, phase 2, open-label, multicenter, 4-week study of sample size 104. Patients aged 12 to 17 years, of both the sex, and with medical history of gastro-esophageal reflux disease symptoms, were included in the study. Patients with conditions such as esophageal disease, eosinophilic esophagitis, Barrett's disease, gastric, and duodenal ulcers were excluded from the study. The primary endpoint was percentage of patients who reported treatment-emergent adverse events. The secondary endpoint was percentage of days without heartburn. The method comprises of 3 periods: screening period, treatment period, follow-up period. There was no death or serious adverse events with the use of the drug. Moderate and severe intensity was minimal. Percentage of patients with no gastroesophageal reflux disease symptoms were comparatively more than other adverse events. From the data shown, it was evident that patients without heartburn increased from baseline readings. The study concluded that dexlansoprazole dual delayed release capsule yields high safety and efficacy in the treatment of non-erosive gastroesophageal reflux disease.